in mental health. So are you a practitioner? You're a, what is your exact title?
So I work for an organization called Mental Health America. I don't own it, even though we have the name and the title. It's a national organization that's been around for over 100 years. And what I do is I'm the vice president of partnerships and community outreach.
Nice. Mhm.
So I'm not a practitioner. I focus more on how we engage with the community in helping them to understand mental health, address it, and really think about equity in that space and what it means when we go out into the world and say everybody should talk about mental health and help themselves, um, with the knowledge that not all the systems that are created were created for folks who identify as BIPOC or within the LGBTQ community.
Sure, absolutely. And so now that it's like it's May, it's supposed to be Mental Health Awareness Month.
Yes.
Is that like a big time of the year for you and
Oh,
your
yes.
organization?
It's one of the busiest times of the year. We have a campaign that we develop each year, but we actually created this observance back in 1949. So our organization was the driver that put this out into the world and said we have to do this on a regular basis. So each year we develop a campaign that really focuses on a unique theme, and then we provide tools for people to actually take information, read it, and integrate it into their personal life so that they can find some help.
Okay, great.
Excellent.
So when you're going out to partner with the community, is it mostly like education and resources that you're giving them, or are you trying to kind of like build family networks around, the work that you do? I mean, are you?
It's kind of a little bit of both and even broader. So we kind of do our work in three particular spaces. One is advocacy. So what we want people to do is get involved at a local, state, and regional level to help change the way that mental health access is provided. So when you think about how much it costs, how difficult it can be to find a provider, we provide tools to help people get involved in that advocacy piece. But then we also provide resources for individuals who themselves may be struggling with their mental health and you're not really certain of where to go to find helpful information. But that is also a little bit wider when you think about the community, right? And if I'm a provider, I may not have the time to create fact sheets and resources, and we have that. So you just have to use ours and get them into the hands of people that you work with.
Yeah, absolutely. So I think I only heard two of your things, so maybe I missed it. So your advocacy resources.
Oh yes, and yes. And the last one is direct service. So we have affiliates. Yes, it's my fault, Karen. We have affiliates across the United States. So these are independent nonprofit organizations that are providing resources and programs to the communities. Some provide resources like our resources, or have things that are working programs in schools, or doing individual therapy, family therapy, or even programs that are intended to get folks back into the workforce. For example, if they were diagnosed with a mental health condition and are coming back into the workforce and thinking about what that looks like.
Sure, absolutely.
Wow, I'm amazed.
Yeah, I mean, gosh, you guys are helping a lot of people and educating.
Yeah. Dr. Walker, I seem like we have about 5 people waiting, so I just want to catch up in and open for them. So essentially, the process is that I'm gonna introduce you, and then you're gonna introduce our Americas. I really love what she stated that they do. Is certainly aligned with what we do here. So I'm gonna open up the room, unless you have another question you need to ask before we open the door for those people.
No, just that I'm gonna keep us on time.
Okay.
3 to 4, right?
Yeah, okay. We have about, okay, let's let them in, I guess.
All right, welcome, welcome.
Okay.
Got a good group here.
Okay. Hello to all of you.
Yeah, they're connecting their audio, so.
Right, I guess okay. Hello.
Hello and welcome. Join the party, invite your friends. We have a great guest with us today, and all of you. See Christina, Stephanie Howell, Paola, Patricia Page, Rosanna. Do we have more? We're letting them in.
All right.
Okay. So thank you for joining us. I am Dr. Karen Walker, and I am privileged to be moderating, and Dr. Joseph Noe has let me take over today to welcome our guest, America Paredes, from Mental Health America, and she's going to be answering any questions you have also, but talking to us about the great work that she has done in outreach for our community and advocacy and some other channels. But I also just want to recognize that it is the month of May, which is Mental Health Awareness Month. And the great work that we can do to educate but advocate for others in our community. But I will let America talk about the work that she does because she's educating me on on some things. So America, let me know a little bit about your organization, Mental Health America. You told me that you're the VP there of partnership and community outreach, but what does that mean for people that are not in this line of work?
Sure. Hi, everybody. Like Dr. Walker said, my name is America Paredes. My pronouns are she and her. So I do work for Mental Health America. We're an organization that was founded in 1909. And in my role here as VP of Partnerships and Community Outreach, what I really do is engage with outside agencies and organizations that are looking to really go out into the world and talk about mental health in an effective manner. So we partner with different corporations and different government agencies and a range of different nonprofit organizations across the US and internationally as well, so that our message gets out into the world, and also we really learn from these other communities so that we can then create materials that are going to be useful. So part of my work also is really about talking to the communities and doing similar presentations to what I'm doing today, so that people are aware of the resources that we have, and that they make use of those resources. Because oftentimes what happens is most people don't know what types of support information and resources are out there, so they are left kind of in the dark. So we're trying to shine a light on that. And I can tell you more about some of the work that we do on a broader scale, but I don't know, Karen, if you had another specific question.
No, I absolutely. So I think that it's for people that don't understand this realm, right? It can be kind of scary if you just hear mental illness. It's like, oh, I don't really want to get involved in that, or I just kind of stay away from that because I don't understand it. So, I mean, you're dealing with the community and kind of educating, because I was asking you about that. Is it education, or, is it more just on community outreach? Is it advocacy? And you're like, well, it's kind of both. So, tell me a little bit about like what has been kind of your most kind of difficult challenge with the pandemic now, because I think it's kind of shown a light for everybody that everyday problems now have become kind of in your face, I think.
Yeah, that's a very important question. And I would like to frame it in this way. because we are 100 years old, 112 to be exact.
That's right. Your organization's
yeah.
well renowned. Right?
We've been around for a long time, and what has really come out of our work is that we have continued to modify the way we talk about mental health and mental illness as the times have changed. Because you're right, within the last year, more people are becoming aware of how closely connected our mental health is to our overall well-being, right? We can't just physically function without considering how we're being affected emotionally. So part of that is tied to how we go out into the community and talk about these issues. For many folks, what ends up happening is I'm sorry, there's somebody like mowing the lawn outside, which is just part of the process in Zoom culture now. What ends up happening is that when people are struggling in any way, and I'm going to call it struggling in general, what ends up happening, people don't know where to go get help. And so when we start talking about anything that has to do with your emotional well-being, it's really important to start from that space instead of just saying, oh, well, I think you may have a mental illness, because that's not what we're saying. Getting diagnosed with a mental health condition is something that may happen farther down the line. But what we know is that people are struggling for a very long time before they get help. And what we like to do is really frame that around what we call before stage 4. So when you think about other illnesses like cancer or diabetes, stage 4 of any kind of these diseases is something that is startling for people, right? If it's stage 4 cancer, you immediately get support and people are providing all kinds of resources for you. Right. With the idea that it's going to be harder to treat and less likely that you'll recover. But what ends up happening within the world of mental illness is that people don't go and get help until they are in crisis. So that for us is stage 4. And what we are trying to do as an organization is help people think about stage 1, stage 2, and stage 3, and thinking about mental health and addressing it way earlier on in the disease process, when you start saying something isn't right, something's not feeling right with me, my mind isn't all together there. And those first signs and symptoms of problem areas in your life could be indicators of further mental health conditions that they could develop. So that's the way we go out and talk about these issues. So it's not this startling thing that says, oh my God, I don't want to talk about this because it's so negative.
Yeah,
that's really, where people are.
I really like that. I actually I've seen that kind of approach a little bit more open now. They've been doing that kind of in the school systems, I think, to show even the kids how to express themselves a little bit better now, especially now going back to school, and their feelings of like kind of a psychological safety, right? That it's can be overwhelming. But I like the way that you're talking about it, that you can kind of have like these stages, and it's not just this is the end right now, right? So but you can have stage 1, 2, maybe 3 and 4.
Yeah.
So what would be some examples of like stage 1 kind of? Could you give me some?
Yeah, I can totally give you some. I would like to say one thing around what you were mentioning. Sure. Oftentimes when you think about our work as well, I really like to frame it in a way that is very easy for people to understand when we talk about anything that's health related. Some days you have good days, some days you have bad days, right? Whether you have like diabetes or blood pressure or anything like that, you can control it and manage it sometimes with medications and other therapies, right? But when you think about mental health conditions, what we know from our research and research in general around these issues is that earlier signs and symptoms of mental health conditions start anywhere between 10 to 11 years old. But people don't actually go and get help until they're in their like early to mid 20s. So that's 10 to 15 years of time that people are struggling. And most often they're doing it alone because there is a lot of shame around talking about these issues. There's a lot of stigma, and even more so in communities that identify as Black or Indigenous or people of color, because we don't talk about these issues. It's seen as a character flaw. So part of that is doing some work to help educate not only youth, but parents and caregivers and aunties and all of the people that we're connected to. But then on the other end of that is also the work that is done around suicide prevention. And like, we value the work that's done in that space, but we know before somebody gets to the point of suicide, they are struggling. So we want to help people understand, if you are struggling, it's okay to talk about these issues. Don't struggle on your own. If once you start talking about it with other people, you'll see that so many people are dealing with very similar issues. So then that lends itself to a conversation that says, yeah, I'm totally not alone. I didn't realize you were also dealing with this, and we can find support together, you know.
Like that. I like that you brought that up about, you know, the different communities, you know, what is kind of taboo to talk about. And in your organization, you know, is it, you know, do you have that support system where, you know, people maybe could feel more comfortable coming because there's people that look like them or represent them? Maybe that they would feel comfortable, you know, maybe talking to them, because I think sometimes that's even an issue, I think, in the mental health kind of community, that you know, it was taboo to talk about in their family, and then the therapist community is, you know, not representative of that culture sometimes. Do you find that?
Yes, it's something that is evident across all of the mental health care space. As a national organization, at the national office, we are not direct service providers. So we're not therapists that can go out into the community. But our affiliates oftentimes have these professionals in their networks. People can always go to our website, which is mhanational.org, to find different resources for BIPOC communities. There's a whole section on statistics related to the way different communities may think about mental health. And there's also some very unique resources that are vetted to make sure that they actually provide the services that they say they do. So for example, maybe somebody who identifies as Black and Black and queer, for example, they may want to find a therapist that is Black and queer and understands their lived experience. So there's some organizations like Therapy for Black Girls that has a database of information of different therapists that do that work.
Wow.
So we have that on our website.
Oh, I was gonna say that's on your website. It's awesome. Okay.
Yes.
I put the link you said in the chat. So
yes, I'm going to add another one so that people have access to it in the chat, which is MHA National /BIPOC. I'm going to add it here for you. And that gets you to information about all the different communities with specific resources. Every July, we also create a toolkit that focuses on a theme that we want to put out into the world so people understand how there may be differences that are very important for BIPOC communities. So that will come out probably around the end of June, and it will be available on that link. But what you are speaking to is very important when you think about, if I'm ready to actually go and find some sort of support, and maybe I'm going to explore speaking with a therapist, knowing how to actually have those conversations can be very difficult. So we have information on how to do that. Finding the right therapist, asking your therapist the right questions to know that they are there to actually be supportive of you, right? So it's not your job as the individual to have to educate your therapist on your culture. So it's very important to let them know, what do I need from this relationship, and what can you give me as a professional in this space? So, yeah.
Right. I think that's, you know, a lot of times, you know, we only know what you kind of, you know, seen on TV of therapists or those experiences, if you've never been to therapy, right? And then that can be scary. And I think if you're feeling challenged, especially during the pandemic and the shutdown, people felt and experienced things we've never felt before. So, you know, reaching out alone during that time can be really difficult and scary. in itself. So these resources will be very helpful. Um, what
We
Oh, I was gonna say, what resources and tools can you talk to about cost? Because isn't that could be an issue
Yes,
also.
that can also be an issue. Before I address that, I wanted to tell you, I
Sure.
added another link in the chat, which is for our mental health month toolkit. Because like you said at the beginning, May is mental health month. It is one of our
Mm,
busiest times of the year. But what we create is a toolkit that has fact sheets, worksheets, social media content, a range of different free materials that anybody can download and then use in their communities. So you can print them out and share them with different people. You can put stuff on your email, you can put stuff on social media. What we want to do is make it as easy as possible for people to take the information and use it. For the reason that it can be hard to,
mhm.
you don't even know what questions to ask.
Right.
So when you think about cost as well, it's very important to think about, for example, cost is a major barrier for some folks, but it's also, when you think about the options that you have available to you to help you address your mental health, that isn't always the direction that people want to go down. They may not want to go to therapy. It takes a long time for somebody to make the decision to actually go and find professional help. And that's not just with mental health, that's in anything, right? Even when we want to make a change for ourselves and we say, for example, I'm sure everybody at some point has done this. Well, I want to lose 10 pounds. I
Yeah, I was
want
gonna
to,
say I want to get healthy. I want to work out,
yes,
or I want to start eating more vegetables. Yeah,
yes.
that's the
Like
bad.
how much time before that actually happens are you buying a vegetable and then it rots in your fridge because you haven't
Mm-hmm.
actually eaten it, right? Or
Exactly.
you've put your tennis shoes by the door, but you haven't actually gone for a walk. So taking time to think about what works for you is very important, but also being patient and figuring out what will work. But if you decide to go in the direction of finding a therapist, there's a couple of options, especially when you think about if you have insurance. If you have insurance, you should always reach out to your insurance company first to ask what type of mental health support they have, the coverage you have. Because it could
Mm.
be that you may have to pay a small copay for, to engage with a therapist. Or if your insurance company doesn't cover that, there are some organizations that provide therapy based on a sliding fee scale, right, where it's based on your income. So they can provide the service based on your income and you provide some information around that. There are also other services now, and especially within the time of the pandemic, that are all telehealth. So they're done online, similar to
Wow.
what we're doing today, right? You can
Mm.
just talk to somebody, a therapist, online through different organizations like Talkspace, BetterHelp. There's tons of them online. Um, so you have to just think about what the best direction is for yourself and figure out what would that look like. Um, so
Yeah. Something that we, are interested in with our group, SDIG, is always looking out for, some of these systemic issues um, and pitfalls kind of within the community and, nationally or internationally. So I'm curious, with your group, your organization, and working with the community so closely, what are maybe some things that you see that you could talk about, that have been, difficult or challenges, maybe reaching certain groups or, that maybe some of our listeners could help with or maybe even speak to, in the work that you do.
yeah, I think two things that come to mind around systemic issues that are always going to be, I think, present unless we do some really hard work,
Mm,
is understanding the limitations that may exist in how the content that is created and the information that is put out into the world by different agencies may not necessarily be using language that we use in our communities, right? So a lot of times organizations and agencies will create and spend tons of money to create campaigns, large campaigns that have all kinds of different information, but they end up finding that a lot of these campaigns don't really get any kind of traction. You know, people aren't really responding to them because they're not reaching the communities that they were intended for. And that sometimes is based on the language that is used. So part of that requires for people to think about, if you're going to create a campaign, involve people who are living with mental health conditions in these processes so that they are part from the beginning, from the inception of this, you know, campaign to the end. Because what we know is that storytelling makes a big difference, right? Seeing somebody that looks like you share their story, share their experience, helps you understand that you are not alone in yours. So that's really one of the things. The other is getting people to engage in understanding the power that they have at the local level to impact change. So when we think about advocacy, and more so within the last year, you know, everything that has to do with equity and social justice really came to a head because people came together around very important areas of support. So they went out and marched in the street, they communicated with their legislators and continued to be involved in their communities. And that's a very important aspect of the work that we do, because we as an organization could try to go out into the world and change things, but the folks that are impacted by all these issues at the community level really have a very important role to play in saying, I'm a member of this community, I think these things have to be changed, and this is what I would want to see as an area of improvement, you know?
Right. Yeah, I like that. So what is kind of maybe one of your proudest kind of moments since you've been working, you know, with Mental Health America, would you say? Or your proudest memories there?
So I've been working with Mental Health America for 11 years this year, which is an amazing thing. I've never been anywhere this long, so I've been sticking around. Obviously, I like it enough to stick around. I think there's one event that sticks out for me. A couple of years ago, we had done an outreach fair where we went out, you know, and had a booth like at a large fair that was occurring in Washington, D.C., because we're based out of Alexandria, Virginia. And what we were doing, we were providing individuals a screening tool. So on our website, which it's actually mhascreening.org, what we do is provide anyone access to 10 mental health assessments that anybody can take. And those screening tools are really one of the first steps that people can engage in trying to figure out what their mental health is like, maybe what their symptoms are like. So when you talked a little bit about what symptoms, you know, are kind of at the early stage, the way that I like to describe that is really when you start feeling like something is different emotionally for you, you're not feeling like something is right within yourself. That's the first step to help you think about what's happening. Why is this happening right now? Is it something related to work? Is it something related to school? And if you kind of narrow it down, you might be able to see distinct kind of symptoms like you're not eating well, or you're eating too much, you're sleeping too much or not sleeping enough. The changes that you have in how you communicate with your loved ones. Maybe at some point you were very tied to like your friends and doing things with them, and then all of a sudden you don't want to do that anymore. You know, it's a little different because of the pandemic, right? Because everybody had to social distance, but even still there were ways that we were connecting. So we provide these screening tools as something that people can use. And what we had gone and done was go out into this community fair, and we were providing these tools on iPads. And there was a young woman that approached us, and we said, would you like to take a screening? And she was a little hesitant to. And her mother was Spanish speaking, and I speak Spanish. So I also asked her mom, would you want to take a screening? And she said, I don't know, and kind of hesitant about it. And then she actually did. She completed the screening. And while she was completing the screen, her daughter also decided to do that. And her daughter got, an immediate result. So you get like an immediate response about where you may be in your mental health. And her daughter had shared that she had contemplated suicide in the past, and her mother didn't know that. So her mom was very surprised at the response that she had given. And, I took them aside and we talked about what that meant for her daughter. And her mom was, appreciative of the fact that we were there to guide her in a direction of finding support for herself, for her daughter, and as a family, so that I think was very important to me.
Wow, yeah, that's really impactful and at a big, stage in her life too, I'm sure.
Yeah.
Wow.
It was very meaningful.
Yeah, and it's, I'm sure you'll remember that always. So that makes me think, with the resources that you have with your organization, you mentioned you kind of have like direct services or directory and things like that. Is it put out there like you have those needs like therapists that do speak different languages and all that in the directory too?
Some of our affiliates have that.
Okay.
We don't as a national organization, but our affiliates who do the work on the ground oftentimes have those needs. So people that are interested in finding an affiliate near us, I'm going to share the link with you. You can go to our website and search different affiliates, and they have different programs. So they might be able to help be in the need of support, like therapists that speak different languages, volunteers that may be wanting to offer up their services, for youth, all of that.
That was my next question then, because I see Dr. Gerald Feinstein or Stein, I might be messing that up. But if someone does want to be an affiliate, or is that they have on your website, can they become an affiliate?
To become an affiliate, there's two options for you to engage with Mental Health America at a broader scale. One is to join us as an associate member. An associate member is actually a paid membership with MHA, where you are given unique benefits and access to some of our resources, like our screening tool. That's something that people can find on our website. I'm going to add the link here. That associate membership allows you, for example, to get a unique link to that screening program, so that you would be able to track how many people complete mental health screenings, for example, from your community, and not track individually. Like, I wouldn't be able to tell that you, Dr. Walker in Mississippi, is taking a screening. It's more just demographic information. The other is, if you do want to become an affiliate, that process is much more lengthier. It requires for organizations to be 501c3s. So there's a whole process there. But I will also add that link just so that people have it.
Sure. So I'd like to be able to let the audience ask you some questions if you're ready, and you can use the hand raising option, audience, if you're familiar with Zoom. And there's Christina Smith, ready and rocking. I see the first hand raised. Go ahead.
Thank you so much. Well, America, thank you for being here. And I have a question. It's really interesting. Dr. Karen Walker and Dr. Nwoye know me really well. I have a lot of energy. I am really passionate about the work that I'm doing. I love it. I am trying to discern the difference between what so many of us are feeling from the pandemic versus other things. So you mentioned sleeping a lot. I have the desire to sleep a lot. And it's so funny because it's not how I normally experience things. To the best of my knowledge, I'm not depressed. I mean, I feel more joyful at this moment in my life than I have probably in many, many, many years. But I'm trying to discern, is this just pandemic related, or is there something else underlying that I'm not even aware of? So how do you sort through that?
That's a very important question. One of the first things I would ask you is if you have recently had like your blood tested, like for vitamin D deficiency. So I say that because oftentimes, um, sometimes when you are low on vitamin D, some of the symptoms that you experience are very similar to depression, like sleeping a lot. And within the last year, we've been inside. A large portion of our time has been inside. And if you did get outside, I would imagine that you really haven't gotten outside in the way that we had previously. So that's an important thing. The other is, I think it's very important to be able to discern what you're asking, right? You're the only one that can judge where it is that you're having some doubts. Because if you are feeling in a very good positive state about where you are mentally and you're feeling healthy in general, it may be tied to some of the issues that occurred last year and continue to be, right? Because we as a people had to adjust. Where we were very active, all of a sudden we were stuck at home and we had to modify everything that we had done. So then our bodies adjusted to a new frame. So again, we're pushing ourselves and we're asking our bodies to move in a different direction, right? Where maybe you were sleeping longer because there was really so much to do. And now it's like, okay, if you try to modify your current schedule, does that impact you greatly? You know, are you having a lot of issues in maybe sleeping earlier? Is that causing you to sleep more or wanting to sleep more? So there's a couple of things that you have to think about. It's also important to think about how physical symptoms can be connected to your mental health. So one of the things that we talk about specifically is the connection that exists between our mind and our body. On the webpage of mhanational.org/May, there is content for this year for our toolkit, but also you have a link to previous years. And in 2017 and 2018, we explored the theme for mind and for body. So I would suggest you go in, and there's a couple of worksheets that are in there because the things that you eat may be impacting how tired you feel. The weight that we may have put on within the last year,
COVID-19.
that's right, could impact how we feel. And I'm in that as well, right? So I speak from personal experience where you're just like, it's easier to just sit because we've been sitting. So you have to ask yourself, and what I like to do because it works for me is I like to write things down. I'm a person that's very visual and I need to write things down. And look at the differences that exist in what I did before, what I'm doing now, and if there is some connection there. And if there isn't, thinking about maybe speaking with others and asking them for your feedback, right? Because they might be seeing things that we are not necessarily paying attention to. So there's a couple of pieces there.
Yep, that's very helpful. Very helpful. Thank you.
Thanks for your question. Anyone else? You can also just raise your real hand and I can see it. If you have a question, or you can put your question in the chat. Dr. Noe, you are always welcome to chime in, or I will keep going.
Thank you so much. It's really very informative information that we all need. My question, though, is with the way things are. The lucky person with whom you met and happened to speak Spanish, and through the course of speaking Spanish, you uncovered that the child had attempted suicide, when in fact we were actually maybe looking at the mother, but in this case, it became the child.
Mm-hmm.
Do you have a similar approach to engaging with some people perhaps may not speak Spanish, or not only being, not that they can't speak Spanish, that often marginalized so much that the humiliation and the human tendency to avoid places where they feel are not treated well? Do you have a mechanism to reaching those people?
Yes, that's such an important question, and one that is very closely tied to my personal experience and where I really dedicate myself, because there are so many layers to the way that communities that have been marginalized process mental health, address it in the long term, right? And for various reasons, oftentimes the systems that are created, even though they say they were created, to help us all, they, in many ways, they have failed us. So we are afraid to go and engage with these systems. And unless you see people that look like you in many ways, or even speak your language, in the case of, this one individual, you don't really know what to say because you want to keep yourself safe. So that comes from a place of fear, and to keep, fear of in many senses, fear of keeping yourself safe, making sure that your family is safe, and you put safeguards to make sure that nobody can infiltrate that, right, and hurt you. So part of the way that we talk with different communities is really thinking about the language that we use, and by that I mean the idioms, the ways that we engage in having conversation around this. So when we go out into the community, oftentimes what will happen, people will say something like, "Oh, you guys are here. We don't need to talk about it. I'm not crazy." That's the language that we use, right? "I'm not crazy." And then what we say is, it's not about being crazy. Everybody's dealing with stuff at different times. So if you're ever dealing with something that is making you not healthy in your mind, or not feeling good to you, then that's your mental health. And when we use those types of words, it helps people feel more comfortable in talking about it, because if you say mental, in a lot of cultures, in a lot of different communities, mental is not a thing you want to be. You don't want to have anything to do with that word. It's scary. There's a lot of negative connotation around it, where you may think like, in different spaces, maybe it has something to do with evil things, spirits that are not doing everything that they can for you. So we have to be very respectful of the different spaces that exist. And the way that we really think about that is by then having the person help us understand where their level of interest is in this space. So if, for example, somebody comes to you and is like, "No, I'm not crazy," and was like, "Okay, it's not about being crazy. It's just about talking about, how you feel. Tell me how have you had bad days and good days?" Most people will tell you yes, right? If they're being honest, most of us have good days and bad days. On our bad days, what's the part that is most distressing for you, right? Is it the relationship maybe you have with your family member? Is it something going on at work? And all of that just enables conversation. And what we find is when we talk about this and we create a space for conversation and opportunity to even think about and openly talk about these issues, then we've already put our literal foot in the door to say, "I'm okay. I'm going to listen to you." And it validates that person's experience. And I think that's one of the most unique, important things about the work that we do. We don't just go out into the world and say, "Hey, everybody should go and get therapy." We can't do that. Not everybody wants that.
No, but I think that last piece was so important. What you said is just making it okay to be not okay, and also to have the conversation about it. And I think, Dr. Noe, you make such a great point, because as we are transitioning and coming kind of out more and us all kind of being more face to face and having these conversations, what I'm finding is I think it's going to be more important that we're prepared to have these mental health conversations, because I think it's difficult for people to talk about this. It was before the pandemic, but even more so, I think, because, think about supervisors and leaders who now, I think they need to be prepared to have these conversations, right? I mean,
Right.
it was difficult before to talk about it, but now, I mean, you're not going to be able to just say like, suck it up, we all had to deal with this.
Right.
But more important that we're able to give them language to use that is more all-encompassing for, people that, I mean, everybody, but I mean, I think it's going to be helpful that we're able to use resources and toolkits to give people a way to have a conversation.
Yeah, I think what has happened within the last year is, for so long, people that had a diagnosis of a mental health condition, whether it's depression, anxiety, bipolar disorder, anything like that, you had to navigate the rest of the world as if they didn't understand. And most often that's just the case. They don't understand because they don't have that experience. But now within the last year, everybody, even if they say they didn't, everybody has had mental health impacts. They are affected by the pandemic. And even though they may not necessarily understand that at their core, they have been affected. So what's important is now we can then say, wow, we have a way to normalize the conversation and say, everybody dealt with something last year. I dealt with this. What did you deal with? And it helps again to normalize it and then validate the experience for people. And even within the workplace, also understanding what that means. So we do a lot of trainings and things in the workplace as well, because we have to be responsive to the communities that we serve. And most of us, unless we're retired or cannot work for some reason, spend a lot of time at work. We engage in relationships with our coworkers, and all of those things impact our daily well-being. So all of that really creates opportunities. It also creates, I think, it will not create, but it will shine a light on maybe some gaps that exist in different spaces. And people are doing a lot of work, not just Mental Health America, but organizations throughout the US and internationally are doing a lot of work to say, it's okay, let's talk about these issues. Let's figure out what we can do to help support one another.
Right, absolutely. Oh, I thought Lydia was raising her hand, but no. Oh, yeah, maybe you get a question, comment.
Thank you, Karen. This is a very enjoyable conversation. Brought me back a lot of memories, especially in my time working with the World Bank Group and the Inter-American Development Bank, by which I saw a lot of these issues in Brazil, and was wondering if any of these organizations are tied in with NGO, non-government organizations abroad, especially in dealing with these mental issues. And specifically, I was thinking about a situation where I came across a kid that was living in the streets from the favelas in Brazil. And obviously he was going through mental issue. It broke my heart at the time, because I was wondering, how is it that the World Bank Group and the Inter-American Development Bank can actually provide the necessary tools to assist through one of our organizations. So as you were speaking, America, I definitely understand your predicament when dealing with certain individuals and certain patients. I, being Hispanic, definitely I can agree that talking about mental issue within our society is a taboo because, like you mentioned before, and probably is a problem of your character. However, when you're outside of our countries, perhaps like the United States, you realize that you're more open, you have a whole lot more freedom in discussing it. But when you're within your countries where they have limited resources, there's certain things that you can't mention. However, when you think about mental issues, you just think about that. Individuals that are schizophrenic, that have some type of bipolar diseases, you don't think about the depression state or anything like that. And it's so rampant in Latin American countries, and it's even more rampant among what you would call the special ethnic groups that are not given the proper care as needed as they should. So my question to you, America, do we have such an organization that do provide counseling, do provide assistance, or at least training to these in these countries so that they will be able to come out of that stigma? After all, we're in the 21st century. So all of this, the things that we're seeing outside the United States, we should not even be exposed to it. But of course, we're not living in a utopian world where everything is perfect. But since we are considered the helping country where everything should be, resources should be given to the world, what are we doing in that aspect?
Mona Lisa is saying you spoke her mind, Lydia.
Lydia, those are such important points. So Mental Health America as an organization does not have any direct linkages with any outside entities in Latin America. We do have some linkages with folks in Africa, some folks in Nepal, and in different spaces. But what I think is important from what you're saying is that there are organizations that exist. And the reason why I know that they exist is when people reach out to us because they find us online and social media, they are reaching out from all over the world and they say, I need help. And they find us primarily because of the way that we talk about these issues. So it's in our name, right? When we say Mental Health America, we don't call ourselves mental illness. And that's because it's done with intention. Mental illness is a very scary phrase for a lot of people, especially when you come from a culture that illness, disease, enfermedad, right, is like, oh, that you only know this idea of somebody who has schizophrenia, somebody who's having some sort of psychosis, and everything else that is compounded that has to do with mental health is then popped into that same frame, right, in that same bucket. But so many more people deal with depression and anxiety than schizophrenia. It's like like, you know, I think it's like 3% of the population. So I think it's important to think about finding the resources, and the way that we do it. We most often start with the International Suicide Prevention Hotlines, because they then have linkages to mental health supports in the country that you need support in. And I say that with caution, of course, always, because the infrastructure that is, you know, in our countries is not always the best. And I know that the infrastructure here in the US is also not the best. You know, it's a broken system as well. But in many ways, we are better than others. But what we want people to do when you think about the resources that we have is they can be translated. Since they're created, what we want is people to take them, and this has happened in many instances where they come back and say, can we translate it into, you know, Bangladesh, for example? And we say, yes, translate it, just, you know, give us credit for creating it, but it's there for you to do it. And if you do that, send it back to us, because that means people are then going to be able to use that resource, and we can use it from our platform to help educate others. And I also think in terms of the impact of social media and how information gets out into the world now, there are a lot of mental health professionals that have found their way onto social media and are engaging in this type of work to educate the community about how to talk about these issues, not waiting until the point of crisis to really get in front of folks. And now creating their own systems of support. That's what we're going to be talking about in July. The theme for that month is strengthening communities, and it's very important within communities outside of, I'm going to say the white majority, even though it's not the majority, but you know, the white society that exists within the United States. There's a lot of conversation going on around what our communities of color have done forever historically, when the systems have failed us in many ways. We have created our own things, like we participate in a lot of religious kind of ceremonies that help us get through difficult times in our life. We may connect with people in our lives, like our aunties or our grandmothers, who guide us through these processes and are the pillars of support in our communities. But because the medical model within the West doesn't necessarily recognize that as a true kind of formal system of support, then there's not a lot of focus placed on that. But I know in my community, when I need something, I go to my aunties, right? They're there. They're always going to be there. So part of that is looking at what exists within our own communities to really help guide that conversation.
Well, I now that when you were saying that, and I'm sorry, I mean, I took your platform for just a second, Karen. I was immediately thinking about even in New York, basically New York and throughout the whole United States, we have sub-communities, subcultures. I was immediately thinking about the Sephardic Jews that are in New York. There's a particular community there where, you know, young ladies are married at 18 years old, unwillingly, not wanting to marry just simply to bear children, very similar to the Amish society. Yeah. And therefore,
there's the caveat, there's the good, and then there's the other side of it, right?
Extreme, exactly.
I was going to ask about that.
You know, there's a lot of women, battered women, that would love to have a support system. Yeah, I mean, particularly, I'm thinking of a friend, Sephardic Jew, a Jewish individual. She got married. They married her with a gentleman that she really didn't want to. She wanted to go off to school. She wanted to study under that particular section or subsection of a community, religious community. The ladies are not allowed, women are not allowed to go to school. They're not allowed to work. They're only allowed to stay home, take care of the husband when they get home, and bear as many children as possible. I understand your point. How is it that they're able to reach out if they want to on a very discreet manner? Because that's another thing. They can't go out, they can't see, people cannot, within their community, cannot know that they're reaching out to get that type of help. But if they can, will they be able to have the privacy and have the discreetness necessary and able for them to receive the help?
Well, that depends on really where they can find the support. In many ways, for any kind of community that may have difficulty in accessing information, a lot of times there have been support systems created within those communities that are then able to guide them to resources, because very similar to anything that's kind of within the domestic violence and interpersonal violence space, you know, thinking about access to information within gender specific spaces like bathrooms and things like that, where information just is there because it's a very unique and private space. So I think there are opportunities for people to engage in that, but we at MHA don't do that specifically.
Yeah, and I was thinking too, I mean, a lot of this is, you know, we're hopeful that we can start getting out resources that are, you know, the healthy coping mechanisms into these communities as well, because if you're not able to get that, then they are coping in, the not healthy ways, right? Turning to alcohol, drugs, other things to mask some of the real problems as well. Because if you can't get help and you can't turn to family to talk to because it's taboo, um, even to talk about, domestic violence or sexual assault, because those things you can't even talk about in your community. Then you have to turn to unhealthy coping mechanisms, which then further exacerbate mental health. So I think that what you're talking about, Lydia, is is difficult if you are only held to a community for support when the community maybe is very, maybe part of the issue. Um, it's complex, right?
Yes, it is very complex, but there are also anonymous spaces online where people can access support, which keeps them a little bit safer, right? Because there is an anonymous nature to it. Even our screening tools are anonymous, so that helps in a lot of ways to get people to feel more comfortable in learning about their mental health. So I think you just have to explore what exists out there. And for people
Sure.
that don't know, it ends up being that folks like you that are on the call may take something from today's conversation and then have it available, right, in a conversation that you have in the future and say, actually, I know where you can find this resource. And it becomes something that is kind of embedded in conversation.
Yeah, I like that, America. Thank you. The being able to be an ally for those particular groups, and being able to show them where some of the anonymous places they can lean on and go to, and let them know that you're a safe person to talk to in those venues.
Definitely.
So I'm seeing some Christina had to jump off, but any other comments, questions for America and her organization? If any other links you want to put in? Oh, yes, Dr. Norway, yes.
As you were talking about the reach of your organization, I kept thinking more on what is happening in Middle East as we speak. There are people who are in situation that is unbelievable. Kids, children, women, and oftentimes we purport to support the helpless, that people who cannot help themselves. And there are too many dimensions of the discussion. On one hand, are people who are saying, he gave advantage to Prime Minister who was in process of being removed. So he took that as a means to strengthen his support, political support, which brings about the question of some people thinking about their political situation instead of thinking about our lives. Then you look at, on the other hand, you see people who are seen as less. And when they look at those who may be much more heavy-handed, they're throwing bomb or doing all these things, they look at the devastation on that ground. I'm wondering the kind of anxiety, the kind of situation those people will be going through, whether or not you have any way to influence either United Nations organization like World Health Organization or all those organizations that purport to be taking care of the world when they're not. Are there ways you can influence in a way that could resonate with human-minded individuals in that organization, perhaps to do something at future time?
So Mental Health America does not have that power, unfortunately. But I think it is important for organizations like yours and people that are connected to the work that you do to go out and ask and advocate for what they believe in. I think trauma is an issue that is apparent, right? And it exists in all of our communities, whether here or in other parts of the world. And the underlying impacts of trauma in the long term are jarring. That's just what we know. And, so part of that is thinking about what, not only within the current situation, but in all of the situations that exist where people are living through very negative situations, finding ways to help support them in the long term, both from a public kind of focus, right, as an organization, and then thinking about what resources may be needed for the future. But I would challenge you guys to go and communicate with your networks and try to help in any way that's possible for any situation.
Thank you.
Yeah, no, thank you very much. I mean, it's touching and heartfelt, everything that's going on over there, and the trauma, of course, post-traumatic stress that it will implement. So I think we are just about almost out of time, and I just want to thank each one of you for joining us, and I want to thank America for you and your time and sharing all these great resources for us. If you want to save the file from the chat, you can. There's 3 dots there at the bottom, and if you click on that, you can hit save, and you can save all those links. I learned that on another panel, so I didn't have to like save all of them and jot them down. So you can save the file. And I don't know where it goes on your computer, but it goes somewhere.
But it's saved somewhere.
Yeah, but you can explore that later. But thank you so much. And you can explore all the things that Mental Health America has to offer. And do you have other social media site links you want to shout out?
Yeah, I mean, we're on all of the platforms. We're on Instagram, Facebook, LinkedIn. You can find us under Mental Health America. On Twitter, you can find us under Mental Health AM. YouTube as well, you can find us under Mental Health America. And I do want to share that if folks are interested, we have an annual conference that's coming up the second week of June. And for folks that participate virtually, it's free. So
wow.
Anybody can join. Let me pop that in here so you have access to that. Anybody can join that event. We do have an event. The same event is going to be held as well in DC in a limited capacity, but that's a paid event. If people can join, you're more than welcome to. But again, a lot of conversation, free content that people can access, a lot of breakout sessions that people can learn from. So you can check us out. Okay. Thank you so much.
Thank you for your time.
All right.
And